Okay, we're still talking about anemias, different types of anemia. So the next type we're going to talk about is aplastic anemia, which results from an impairment or failure of the bone marrow. And failure of the bone marrow leads to loss of stem cells and pancytopenia. Pan is all, cyto is cells, penia is low. So all blood cells are deficient. That's not good. So you get decreased numbers of erythrocytes, decreased numbers of leukocytes, decreased numbers of platelets or thrombocytes. You can imagine what sort of problems that might cause. Lots of serious complications with aplastic anemia. Additionally, the bone marrow there are a lot of changes in the bone marrow. So it's very serious. It may be temporary or it may be permanent. A lot of times it's idiopathic, meaning we don't know what causes it. It's in about half of the cases, middle-aged patients with unknown cause. And that is the most common, the primary type. Other causes include myelotoxins like radiation, industrial chemicals like benzene, certain drugs that are used for other things that may damage the bone marrow. In the cases of myelotoxins, it's really important to detect and remove the causative factor to allow the bone marrow to recover. So that's the cases where it's reversible. If you're being exposed to something and you can stop that exposure, then yay. When severe aplastic anemia because of cancer treatment is a risk, the patient's stem cells might be harvested and then transfused later when they're needed. So sometimes you need drastic treatment for cancer, and sometimes it involves getting rid of all your bone marrow, and you might need a bone marrow transplant as well. Certain viruses, particularly hepatitis C, may cause aplastic anemia. Autoimmune diseases such as lupus, SLE, can affect the bone marrow. Genetic abnormalities can cause aplastic anemia. Myelodysplastic syndrome is one of them. Fanconi's anemia also affects bone marrow function. So serious stuff here. In order to diagnose it, they do blood counts. When the blood counts indicate pancytopenia. So you have anemia, leukopenia, and thrombocytopenia. So it's not just anemia, you got the other ones too, just to make it interesting. They might have to do a bone marrow biopsy to see what's going on in the bone marrow. And the erythrocytes that are there often appear normal. So unlike other forms of anemia where you have the microcytic and hypochromic red blood cells, with aplastic anemia, your erythrocytes might appear normal. So the identification of the cause and prompt treatment is needed for bone marrow recovery. So you have to remove any bone marrow suppressants, and if you can't identify the cause and treat it, then it can be life-threatening. So this can be a life-threatening illness, unfortunately. So the signs and symptoms, the onset's insidious. Because the entire bone marrow is affected, usually you have the classic signs of anemia: pallor, weakness, dyspnea, leukopenia or recurrent multiple infections because of the leukopenia, thrombocytopenia. So you might get those petechiae, the flat red pinpoint hemorrhages on the skin. You might have the tendency to bleed excessively, particularly in the mouth. As the blood counts diminish, uncontrollable infection and hemorrhage are likely. So it's not just the signs of anemia that you get with aplastic anemia, you also get the signs of leukopenia and thrombocytopenia. So serious stuff. Hemolytic anemia results from excessive destruction of red blood cells. So lots of different causes. Infections such as malaria is one of the effects of malaria is caused by hemolysis. Genetic defects, immune reactions, changes in blood chemistry, infections and toxins in the blood, and antigen antibody reactions like an incompatible blood transfusion or erythroblastosis fetalis, which is a birth, something that happens at birth. So huge problems. So there are classes of hemolytic anemia, one of them which we're going to talk about, sickle cell anemia, and that is a genetic issue. So sickle cell anemia is autosomal. It's incomplete dominance. So we talk about dominant and recessive when we were talking about genetic disorders. You can have incomplete dominance. So you can have, sometimes it's dominant, sometimes it's not. Just make it confusing. It's not as all black and white as we first start to talk about. Anemia usually occurs in a homozygous recessive. Diagnostic testing is available. It's more common in individuals of African ancestry, but people are more mixed up with globalization. You could have the gene and not know, you could easily not know your ancestry. So you can say it is more common in individuals, but you really don't know. Interestingly enough, the heterozygous condition, where the genetic condition isn't manifested, is somewhat protective against malaria, which is also hemolytic anemia. 1 in 10 African Americans is heterozygous for the trait. So interesting. So sickle cell anemia is characterized by an abnormal hemoglobin, which is called HbS. Remember, in molecular biology, the basic tenet of molecular biology, DNA codes for RNA, which codes for genes, which codes for proteins. So if you have a defective gene, you're going to have defective RNA, which is going to make defective protein. Okay, so hemoglobin is a protein, and the defective gene causes abnormal hemoglobin. So in people who are homozygous for the gene, most of the normal hemoglobin is replaced by the defective hemoglobin, and it results in the clinical signs of sickle cell anemia. So there's a great variation in severity of the clinical signs, and it's usually the altered hemoglobin is unstable, and it changes shape when you have a condition of hypoxemia, which is low oxygen in the blood. And what happens is the sickle-shaped cells are too large to pass through the microcirculation. Remember we said those little tiny red blood cells have to pass through those itty-bitty little capillaries, one cell at a time. They line up, they go through one cell at a time. The sickle-shaped ones are too big and they can't get through there. So it obstructs the capillaries and it leads to multiple infarctions in areas of necrosis. That's a problem, right? Especially depending on where it is. So multiple infarctions can affect brain, bones, and organs. Serious stuff here. In addition to basic symptoms of anemia, you also get hyperbilirubinemia, which is the bilirubin is the product of the liver, and you get a lot of it in your blood. Jaundice, which is the yellow skin condition, and gallstones, which is buildup of minerals and materials in the gallbladder, and we'll talk about gallstones more in the digestive chapter. All of those things are caused by high rates of hemolysis. Clinical signs don't usually appear until somebody is over 12 months old. So when you're a baby, you don't know you have it. Once you get to be a little child, you might start to have signs. So the other manifestations of sickle cell anemia, severe pain because of ischemia of tissues. That kind of makes sense, right? Hopefully. Pallor, weakness, tachycardia, dyspnea, classic anemia signs. Hyperbilirubinemia, which is more bilirubin in your blood, which causes jaundice, that yellow appearance. Splenomegaly is an increased spleen size. And that's because those damaged red blood cells go to the spleen to get recycled. The spleen's full of them. There's like standing room only in the spleen, right? So vascular occlusions and infarctions, because those little sickle cells getting caught up in places in the lungs, that can cause acute chest syndrome in smaller blood vessels. It can cause what's called hand-foot syndrome. Delay of growth and development. That makes sense, right? Things aren't working right. And eventually everything leads to congestive heart failure. Not everything, but a lot of things lead to congestive heart failure. So it's not a good thing. It can be diagnosed through a blood test. Hemoglobin electrophoresis, it separates out the types of hemoglobin. And a prenatal DNA analysis can be done, so you can know what you have to prepare for if your child potentially has it. It's treated by, there's a drug called hydroxyurea, which has been shown to reduce the frequency of a sickle cell crisis, which is a good thing. Dietary supplementation with folic acid, bone marrow transplantation, so you get healthy red cells in there, and immunization in children against pneumonia, influenza, and meningitis. Because pneumonia, influenza, and meningitis are all going to decrease your oxygen level, creating the hypoxemia, which can precipitate a sickle cell crisis. So it's almost like the blood cells are going along just fine until the oxygen decreases, and then they sickle and get stuck in the capillaries. So if you can prevent that hypoxemia, then you can avert or decrease the frequency of sickle cell crisis. So this is a comparison of the different anemias that we've talked about. This is a lovely chart for you to study from. This is in the book. My favorite little green and white charts, right? So it talks about each one of the anemias has a characteristic red blood cell, except aplastic anemia, the red blood cells are normal, but you have pancytopenia. But iron deficient anemia has small, pale, red blood cells because of decreased hemoglobin production. Pernicious anemia has the big boys, the big nucleated erythrocytes with a short lifespan. Aplastic anemia has pancytopenia. Sickle cell anemia has those elongated red blood cells when oxygen levels are low, and those elongated ones also have a short lifespan. The etiology, iron deficiency, can be caused by decreased intake, malabsorption, or blood loss. Pernicious anemia, deficit of intrinsic factor. Could be an immune reaction, autoimmune. Aplastic anemia is bone marrow damage or bone marrow failure. Sickle cell anemia is a genetic recessive inheritance. Iron deficiency anemia has the classic, all of these have the classic anemia effects: pallor, fatigue, dyspnea, tachycardia. In addition to that, pernicious anemia also can have neurological damage and achlorhydria, which is decrease of the hydrochloric acid production in the stomach. Aplastic anemia, in addition to the classic effects, can also have excessive bleeding and multiple infections because of the thrombocytopenia and the leukocytopenia. Sickle cell anemia can also have those sickle cell crises that are painful with multiple infarctions and hyperbilirubinemia. Say that 10 times fast. So knowing the comparison and knowing the difference between the different types of anemia, this is a lovely chart for everything in a nutshell.